Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to our usual Wednesday news conference for the latest in COVID-19 information for the Amarillo community. Once again, we do these every Wednesday at 11. Let me go ahead and introduce who is on our panel today. We're joined by Amarillo Mayor Ginger Nelson, Casie Stoughton, Public Health Director for the City of Amarillo, Dr. Brian Weis, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Lamentier, Chief Medical Officer for BSA, Dr. Rodney Gonzalez, Director of the Amarillo VA, and Amarillo City Manager Jared Miller. What we'll do is we'll turn it over to our panel members for brief introductions, and then we will take questions from our media members who are in attendance. Let's go ahead and start with Amarillo Mayor Ginger Nelson. Mayor, how are you this morning?
I'm well, Dave. Thank you very much. And thank you, Amarillo, for tuning in just to stay engaged and get an update on where our city is in fighting the coronavirus. I just have a couple of brief points this morning, and they're mainly tied to the announcements that the governor made not too long ago, and some changes that we've made to our dashboard. Casey's going to talk specifically about that, but I wanted you as citizens to know that that dashboard is constantly changing and evolving as we feel it's best to give you as a citizen the information that you need to know where we are as a city and how we're responding to the COVID-19 outbreak. The governor put out a target for us on a hospitalization rate. And so that rate is now showing on our daily report card, as well as you can see it on AmarilloAlerts.com. And I just want to remind everyone that while for the last 6 months in our response, the data on our dashboard has been everything in Potter and Randall County, which has been a little confusing for us in rolling that out because we think regionally, we think as a panhandle, but the data that we have access to is only the data in our Potter Randall County area. So that's what's been on our dashboard. We're now adding the number that the governor is using, and we're getting that straight from the same source that the governor's office is using on hospitalization rate. So that one hospitalization rate number does reflect 25 of the 26 panhandle counties. And that's what Austin is using to gauge how Amarillo is doing in responding to any outbreak problems here. So those are the two things that I wanted to bring to your attention as a citizen this morning. But most of all, I just want to say thank you. Thank you for the choices you're making to help keep our community safe. I know that we're having to adapt, and some of those things are wearing a mask or staying home if we have the sniffles, but it's important for keeping our community safe. So thank you for the sacrifices that you're making.
Thank you, Mayor. Let's now go to Casie Stoughton, Public Health Director for City of Amarillo. Casie, how are you?
I'm good. Thank you, Dave. Just a recap of the numbers for this week, and then we'll talk about the dashboard that Mayor Nelson mentioned. So as of yesterday, there were a total of 7,676 cases of COVID-19 reported in Potter and Randall counties, 4,654 in Potter County and 2,722 in Randall County. That leaves us with, we do have 1,022 active cases, as we've had 6,254 recoveries, and we're up to 100 deaths here in our community. Each of the cases do represent a unique individual. The rolling 7-day average positivity rate for the Potter Randall community is up to 25.4%. And then the drive-through testing site, the positivity rate there is at 18.4%. The public health drive-through remains open, and that's free of charge for anyone who needs testing. You can call 378-6300, and our call takers will screen and direct you to the test site. Like Mayor Nelson said, we do constantly evolve the dashboard, and so there's two major changes to the dashboard that I want to draw your attention to. The first one is the number there, the hospitalization rate that the governor has set. He set a bar of 15%. And so if the hospitalization rate for the 25 county region, that Panhandle RAC region, we have to be under 15% for 7 consecutive days, and we can remain open at 75%. If we are over the 15% mark for 7 consecutive days, then we go back down to that 50% occupancy capacity mark. Today, we're at 11.97%. And that hospitalization rate is on the dashboard today. You can see it there along now with the total COVID tests and the pending tests from the drive-through. And so those are new data points that were on the report card, and now they're also on the dashboard. The other piece of information that's on the dashboard are the the number of cases per school campus. And so if you go to the map, there's a tab there that says cases by zip code. There's also a tab under the map that says cases by school. What's important about this is that you can click on the campus of your choice, and it will tell you the total number of cases that that campus has experienced, plus the recoveries that they have also experienced. And so that's very important as well. It's important to note that the number of cases, the count started when all school activities began. So not necessarily just the start of the school year, but even previous to that, when maybe they were having football practice or any number of activities before the official day of school, but they were having school sanctioned activities. And so all school related cases are there on the dashboard. We are seeing an increase in cases here in our community, and so I do certainly appreciate, like Mayor Nelson said, us pulling together as a community, wearing our masks, good hand washing, social distancing. If you're home, if you're sick, stay home unless you need to seek medical care. If you've been diagnosed with COVID, it's so important that you stay home for a minimum of 10 days. Stay isolated away from others in your home. If you've been exposed to someone with COVID, that's 14 days. And so we just want to really do our part to slow the spread of COVID in our community. Dr. Gonzalez, many times here in September, has mentioned Suicide Prevention Month. And so the good work that our partners at the Panhandle Suicide Prevention Coalition, the Amarillo Area Suicide Review Team, and the LOSS team, we have worked with our communications team, and there'll be billboards up around town communicating different resources that our community can tap into, especially if you or your loved ones are experiencing those thoughts of suicide. And so just want to share hope and resources this September. And that's all I have today, Dave.
Thanks, Casie. Now I'll go to Dr. Brian Weis, Chief Medical Officer for Northwest Texas Hospital. Dr. Weis, how are you today?
David, I'm content. I got my flu shot yesterday. I laughed, I cried, 2 thumbs up for the whole experience. So I would recommend it for everybody. Just to briefly talk about, there were some concerns throughout this pandemic about certain medications people were using that may have complications with COVID. As Dr. Lamentier a couple weeks ago reminded us, this virus enters the lungs through the angiotensin converting enzyme 2, or ACE2 receptor. All right, and the first concern was ibuprofen. This has been shown in rats that ibuprofen increases the number of ACE2 receptors in the lungs. The question was, if that's true in humans, would that increase the number of portals or entryways for this virus into our bodies? But the more important medications that have come under question are the angiotensin converting enzyme inhibitors, or ACE inhibitors, like lisinopril, or the angiotensin receptor blockers like losartan. And these are very important medicines that lots of people utilize for blood pressure control or for treatment of heart failure. The same thing, these 2 drugs work on that same system that has that ACE2 receptor that the virus enters through. And so the concern was, again, are we possibly making it worse for people on these drugs if they're exposed to COVID? This week, 2 good studies came out of Europe looking at ibuprofen as well as ACE inhibitors and ARBs, and thankfully showed that none of these drugs show any kind of significant effect in the face of COVID with regard to increasing hospitalizations, increasing ventilator needs for patients, or increasing deaths. So the take-home message is you are safe to use these drugs, and please use them for your health, particularly ACE inhibitors and ARBs, without concern for COVID. Now to move to our numbers. So we have 24 positives in the hospital at Northwest today. That's down from the 30s last week. Right now we're using 17 of our ventilators. Thankfully, only 4 of them are required for patients with COVID. Now, the number we're not so happy about is we have had 10 patients succumb to COVID-19 complications this month. So that is tragic for all 10 patients and obviously their families. Casie talked about this 15% limit on hospitalizations, and we're going to honor the governor's executive order. My concern is that 15% may not reflect our critical care capacity. And the problem is at Northwest, we have been at nearly 100% critical care capacity for the last week. And that's a big concern, because obviously as these patients get very sick, that is the resources they need, and not necessarily is reflected by the entire number of hospitalizations. With regard to remdesivir, we have enough remdesivir to treat 60 patients. Right now, we have actually 9 patients on it, and most of them are receiving only a 5-day course and show improvement in those 5 days. With testing, we are seeing 4 to 8 positive tests a day. That puts us at probably a positivity rate just less than 10% of our total testing. And we are really moving mostly to the antigen testing at this point. We've had no change in our visitation restrictions. It's 2 visitors per room between the hours of 8 a.m. and 8 p.m. The only thing that we ask is that if you bring a larger group of people to the hospital and you have 2 people in a room, we ask that the rest of those patients not congregate in our front lobby, just so we keep our staff safe and keep each other safe by not congregating in the lobby. And lastly, as Casie said, in terms of Suicide Prevention Month, this Friday is the actual National Law Enforcement Suicide Awareness Day, Friday the 25th. And as we've done in the past, we're going to mark that day by having the colors presented by the police crisis intervention team, accompanied by the bagpipes from the fire department. But it's critical. They're saying upwards of 40% of first responders suffer from basically mental illness or substance abuse due to the stressors of the job. So it's important that all of us, families and friends of our first responders, are aware of this so we can help keep them safe, make them aware of resources like the pavilion that can help them in time of need. That's all I have for today. Thank you.
Thank you, Dr. Weis. Now I'll go to Dr. Michael Lamentier, Chief Medical Officer for BSA. Dr. Lamentier, how are you today?
I'm doing well. Thank you. Good morning, everybody. I think that, as was mentioned already by Dr. Weis and also Casie, we are definitely seeing another surge in our community in terms of total number of infected individuals and those that are requiring hospitalization. When we look at our DSHS numbers, which Casie has been reporting for us nicely, we're looking at about a 9.7% hospitalization rate is what we're being quoted. And today we are up to 49 patients that are hospitalized at BSA that have COVID confirmed. That 49 number is the highest we've been since the peak we had at BSA back on May 8th earlier this year. We've been in the 40s with confirmed cases since last Friday. Out of those 49 patients that are currently admitted, 19 of those are in our ICU and 6 of those are on the ventilator. At this time, we do not have any pediatric patients admitted at BSA with COVID confirmed. We are seeing overall for the testing that we're doing about a 12% positivity rate this month. Since the outset of the pandemic, if you look at the nearly 10,000 tests that BSA has done, we're at about a 16% positivity rate since the outset of the pandemic. We're still getting large numbers of patients coming through our respiratory triage center and our ER, which is a separated area, if you will, to keep those patients isolated from those that are not suspected to potentially have COVID. And we're ranging anywhere from the high 30s to the 50s in terms of patients coming through that unit in a 24-hour time frame. We're doing also somewhere in the range of 100 tests per day at BSA. When you look at our total testing that's going through our hospital and also through our ambulatory sites that funnel back up to the hospital as far as that testing is concerned. We are looking at an antigen platform. Once the test kits are going to be available for us, and hopefully over the next couple of weeks, we'll be able to add that to our armamentarium of testing capabilities. At this time, the bulk of our testing is being done with our Cepheid device in-house, which allows us to turn around tests within 1 hour as far as those results. Again, it's critical for us to recommend to the public and to those that are obviously visiting BSA to see loved ones that may be admitted, that masking is essential, that attempting to socially distance a minimum of 6 feet when possible is really also critical. We now, since the outset of the pandemic, are at 585 at least unique admissions. And, we are looking at a significant number of patients since the outset of the pandemic that have died, and those that are hospitalized. And again, just to remind everybody that this is a serious disease that does not only affect the elderly and the infirmed, and that there are occasionally individuals that are younger that are succumbing to the illness. We're all aware that there's a vaccination strategy across the country. There are now 4 vaccines that are in phase 3 trials. And as Casie and Dr. Weis mentioned, and Mayor Nelson, we are trying to prepare for the eventual implementation of how we would get vaccination once we get it here, distributed to individuals in an appropriate fashion with an appropriate hierarchy for those that are at highest risk. And we're working with our partners at the Public Health Department to provide them with our estimates on staff and folks here at BSA that would need to be potentially and offered potentially vaccination. So we do feel like there is some positivity on the horizon here with the vaccination potential. I think most of us feel like that's really going to be the best bet for us in terms of getting ahead of this disease. Last thing I will say is that from a standpoint of visitation at BSA, we're continuing with restrictions, obviously now with a number of cases that we have that are coming to BSA and that we're caring for. We do have to have an ongoing policy that allows a visitation as much as able, but also protects our patients, our staff, and others. And therefore, we'll continue to implement that restrictive policy and try to work with every patient and family member so that we can accommodate their needs. That's all I have today. Thank you.
Thank you, Dr. Lamentier. Now to go, Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
I'm doing well. Thank you, David. First, just to cover our numbers, currently we have 2 COVID positive patients in-house. 1 is in the ICU. And then we have 18 veterans who we have tested here that are positive, but they are home on self-quarantine. And we do not have any veterans for which we are waiting their result back right now. Just like to reiterate what everyone else is saying concerning the importance of, social distancing, wearing your mask, and good hand hygiene, not only for COVID, but also as we get into the influenza season. And that tethers me to is for our veterans out there who are wondering when our flu fair will begin. It will begin on Monday, September 28th here on the Amarillo campus, and it will go through October 3rd. We will have a flu fair going from 8:30 in the morning to noon. And the difference between this one and past ones, in the past, you came into the hospital and were vaccinated. This one we're all doing in the parking lot. And so encourage you, for veterans who cannot come during those times, is understand we'll still be able to get it through your primary care physician here at the VA. As always, I do want to thank what our staff is doing for the pandemic response, hurricane response, and specifically the staff that have contributed to our influenza vaccination plan. I know the plans that we have set out for influenza will help us as we begin to also look at moving forward for that COVID vaccine. And so thank you again to the City of Amarillo for this opportunity to talk to my fellow veterans.
Thank you, Dr. Gonzalez. We'll now go to City Manager Jared Miller. Mr. Miller, how are you today?
Doing good. Thanks, Dave. Just want to remind everyone that the drive-through testing center remains open. If you feel sick, you have symptoms you think might be COVID, call the public health hotline at 378-6300 to be screened for the drive-through testing center. Amarillo City Transit is providing free transportation for individuals approved for a COVID-19 test by the Amarillo Public Health Department. If you're approved for testing, call Amarillo City Transit at 378-3095 to arrange for free transportation. We're also under a number of governor's executive orders right now. Governor Order GA-29, Executive Order GA-29 requires everyone to wear face coverings when inside commercial entities or other buildings or spaces open to the public, or when you're in an outdoor space, wherever it's not feasible to maintain 6 feet of social distancing from another person not in the same household. So we're still under GA-29 regarding the face coverings. We're also most directly affecting the city of Amarillo is GA-30, Executive Order GA-30, which until it will continue until modified, amended, rescinded, or superseded by the governor. It supersedes GA-28, which we were under from the middle part of June. So under GA-29, we have a number of different occupancy limits that affect the city of Amarillo. 50% occupancy limits on outdoor areas, events, or establishments for professional, collegiate, or similar sporting events, amusement parks, swimming pools, water parks, museums, libraries, zoos, and aquariums. All those things are still under at 50%. As we're not a high hospitalization rate RAC right now, the following may operate at 75% occupancy. Retail stores, restaurants, office buildings, manufacturers, museums, libraries, gyms, and exercise facilities. If, however, our area has a higher than 15% hospitalization rate for 7 consecutive days, then we move into a high hospitalization rate area. And all of those I just listed would go from 75% down to 50%. So that's why it's very important for us to all do our part to keep that hospitalization rate down. Areas with high hospitalization mean any trauma service area, TSA or RAC, that has had 7 consecutive days with more than 15% hospitalization rate. We also have no occupancy in certain businesses. Those include cosmetology salons, massage establishments, and other personal care and beauty services. So you can see we have 50% category, 75% category that could go to 50%, and then also 100% categories. So we're managing a number of different occupancy rates that are allowed right now. Finally, bars may not offer dine-in services. People shall not visit bars or similar establishments that hold a permit from TABC. However, bars may provide drive-through pickup or delivery options for food and drinks if allowed by TABC. And this calls in another action that TABC is taking to help bar owners right now. They're allowing them to have a temporary certification as a restaurant. So they're taking steps to modify what they serve to make sure that they're serving more than 51% food so that they can fall into that restaurant category. And they'll have the same inspection and sanitation requirements that we have for all of our other restaurants in town. That's all I have, Dave.
Thank you, Jared. We'll now go to taking questions from our media members who are in attendance. If you have a question for an individual member of the panel or the panel as a whole, that's completely fine. Let's go ahead and start with, if I'm not mistaken, Kevin Welch of KFDA News Channel 10. Kevin, how are you this morning? Kevin Welch of News Channel 10, how are you?
Doing well, thanks.
There you are, Kevin, how are you?
Yeah, sorry. Yeah, can somebody from the city tell me how they arrived at the number of more than 800,000 syringes being needed for vaccinations?
Yes, so we wanted to make sure that we had enough syringes for everyone in our community. And then there's 2 different types of syringes. So we know that most of the vaccines are administered through one type of syringe, but we certainly want to make sure that we have covered all of our bases with the planning there. And so we have ordered 2 different types of syringes and enough for our community.
Okay, and Casie, can you back up just a little bit about the hospitalization rates? What is the local rate and the regional rate?
Sure, so the local rate, as on the dashboard currently, it's 7.99%. And that is measuring the total number of COVID patients out of the number of, the total number of COVID patients who are in the hospital out of the active patients. And so it's answering a different question than what the DSHS number is. And on the dashboard, the number is, the DSHS percentage is 9.7%. And they update that number each day at 4 o'clock. And so I just checked And that number for today, and we'll update it at 2 o'clock, but that number today is 11.97%. And they're looking at, they're asking the question about, they're looking at the total number of hospitalized COVID patients out of the hospital census. So it's looking at two different questions.
Yeah, that's why it gets confusing. Thanks.
Yeah.
Is there an overall increase in hospitalizations that are affecting our local rate besides COVID?
Yes. No, so our local rate would only include those, the number of people who have COVID-19 who are in the hospital.
And what about the regional rate? Has it affected that?
Yes.
And I would say, I may be answering the question. We certainly at Northwest have seen a significant increase in our total volume in the emergency room. So yes, I mean, in that sense, if that's what you're asking, we're seeing a lot more patients coming in for non-COVID related issues, and volumes have gone really back up in terms of our hospitalization, our occupancy. We're back up to where we were before COVID with regard to hospital occupancy.
Okay. And Casie, I think you said last week that you were training more contact tracers. Is that right?
Yes, sir.
So is that complete?
Yes, so we, the training is always ongoing here, but yes, those contact tracers have completed their initial training and are all working cases.
Okay. And do you have enough tracers given the increase in active cases?
We're always evaluating that and evaluating our processes and seeing how we can do things faster. So we appreciate the support of the city management allowing us to flex our staff and surge up as we need. And so we'll always be looking at that.
Okay. And I don't know, before you talked about Labor Day and back to school causing numbers to go up, do you anticipate active cases remaining at current levels for a while?
I think for probably at least a couple of weeks, maybe 2 to 4. It takes a little while for cases to recover and then to roll off, and so we. And I think that, as a community, we certainly all are in, we're all in on this situation. And so as we have to work together, and by wearing our masks, by social distancing, by staying home when we're sick, we have the choice here in Amarillo on whether or not our cases continue to go up or if they go down. And so I believe that we will make that choice and that we will do a good job with those prevention efforts, and that we'll see our cases go down.
Okay, thanks. That's it for me.
Thanks, Kevin. Let's now go to, if I'm not mistaken, Matthew Kinchla of KVI Channel 7. Matt, how are you? Let's go to Matthew Kinchla of KVI Channel 7. Matt, how are you? We'll come back to Matt here in just a second. Let's go to David Gay of the Amarillo Globe News. David, how are you this morning?
I'm good. Good morning, everybody. Just a few clarifications on the education part of the dashboard. First off, I know you said, Casie, that there will be a map with different campuses and such. Is there a list on the dashboard of district totals, or is there just the campus map for those cases?
It's just the campus map, and it's live right now. In fact, I'm looking at it on my other screen, so it's live right now, and you can click on the different campuses. But right now, it's just the campuses.
Okay, and then how often is that updated? Is it updated just as cases come into the public health department from each campus, or is it at a certain time each day?
It's updated at the same time the rest of the dashboard is updated, generally around 2 o'clock every day.
Okay, thank you for that clarification. I appreciate it. I guess the next question I have is, I guess for the panel, I guess with the hospitalization rate, the more regional hospitalization rate rather, being focused on by the state, has there been more communication with other counties in the area surrounding COVID-19 or anything like that because of what Austin is looking at to determine occupancy rates?
I would say, David, not from our experience right now. We hear from the other facilities that keep us updated as they may transfer needy patients to a higher level of care, but that's about it.
Yeah, I would agree. There's not any increased communication from a needs analysis standpoint. We are getting transfers from the satellite communities and certainly taking those as able, but nothing has really changed dramatically there.
Okay. What about at the city level? Is there any change in conversation with other cities, other counties in the Panhandle, just keeping track of that regional rate?
No, there's no change. We were already communicating on a regular basis with our neighbors, not necessarily specifically about this, but also staying in touch with each other so that we're employing the best practices with regard to how we assist our community, how our public health departments are working with the community. But it has not increased that level of communication based upon the governor's metric.
Okay. That's all the questions I have. Thank you guys. Have a good rest of your week.
Thank you, David. Let's now go to Aaron Langston of KAMR Channel 4. Aaron, how are you today?
Pretty good. How are y'all?
Good, thank you.
First question is, when it's all complete and updated, what all information will be available on the school dashboard?
So right now, this is complete. As we, we try to make sure that there is information that people can make decisions with that they need to make. And so right now, this is the information that is complete. If there's another large change, then we'll certainly let our community know.
Alrighty. And on the hospitalization rate and numbers on vent usage and ICU usage, where are we standing compared to May and June when we were probably at our highest levels in the area?
I'll say it Northwest. So we're using 17 of our 40 vents. I mean, rarely have we gone much above a 50% utilization rate on the ventilators, which is great. The concern is the actual critical care beds. So besides just the COVID patients, we've got increased occupancy from people in need of critical care for other reasons. So that's been our concern, is really the fact that over the last week, we have been almost tracking at 100% capacity in critical care right now.
Yeah, and I would say the same at BSA. ICU capacity has been the biggest concern. We are looking at alternate ways to potentially enhance our ICU capacity and our intermediate care level capacity rooms. But we are less than 50% of our total ventilators being utilized now. We also have been stocking up on high flow nasal cannula oxygen setups, and we're at less than 50% utilization of those because of the increased acquisition of some of those devices. And really also of note is with the quarantines that we have of staff and some of the nursing staff that we've had to have quarantined when our census is high, and we're quarantining any nurses, obviously that's a concern for us. So those are some of the most salient points.
Alrighty, and that kind of leads into my last question. Are we seeing more or an increase in your staff exposure, whether from work or personal time, or are we kind of holding steady where we have been?
From our standpoint, we're holding steady. We still have the predominance of our staff employee exposures are coming in the community, and they're not occurring in the workplace. We are continuing to stress the importance with our staff of PPE. We did augment our staff that are even taking care of non-COVID patients wearing KN95 masks when they're within a certain radius of patients or in their rooms. This way to try to overall improve the level of protection that we're providing to our staff members at BSA. And when we have had patients with COVID, adjacent, if you will, to any staff member for care reasons, if the staff members are wearing appropriate PPE, we really have had no infectivity of staff in that situation. When staff have become infected, it's been because of a scenario where the patient was not even suspected to have COVID, in some cases testing negative initially when they hit the hospital. And the staff member did not have a component of PPE on, whether it be eye protection, et cetera.
Yeah, and I would say our experience is the same as what Dr. Lamentier was talking about. Is we have a kind of a constant number of employees either under suspicion or testing positive, and it's predominantly over 90% family contacts. And especially now, we have a number of staff having to leave because the children are at least showing symptoms at school and therefore are being taken out of school, and that takes mom out too a lot of times. So yeah, a very little hospital-acquired exposure, mostly community.
All righty, I think that has me covered. Thank you very much.
Thank you, Aaron. We'll now go back to Matthew Kinchela, KVI Channel 7. Matt, how are you today? Now go back to Matt Kinchela of KVI Channel 7. Matt, how are you? Yeah, Matt, we can't hear you. Can Matt Kinchela of KVI Channel 7.
Oh, yeah.
I'm going to try one more time. Now, hold on just a sec. Matt Kinchela of KVI Channel 7.
Can you guys hear me?
Yes, we can hear you now. How are you, Matt?
Sorry about that. Good morning, everyone. I'd like to know, what are some common after effects of the virus, and are there any chronic illnesses that are possible with this?
Man, I can answer real quick. In terms of the patients I've talked to, and particularly the number of our staff, I think the biggest thing is the shortness of breath, or at least the feeling of reduced pulmonary capacity for sometimes weeks afterwards. So I've heard that from a number of patients, and they just don't feel like they can get their breath like they used to prior to the infection. And the other thing is in those that lost their sense of taste or smell, that can persist for weeks too. So those are the two most common things I've heard from people who have recovered from the virus but have these ongoing symptoms.
Okay, perfect. And as far as social media goes, there's several posts about people kind of dismissing the virus, claiming that you either pass away from it or it hardly affects you. But I mean, this is a serious virus. Do you have anything on that?
I mean, I think that it's just critical to re-emphasize that there is a spectrum of illness with this virus, as with many other infections. And some individuals that are infected will have a very mild course of disease. And I think this has been stated on these calls weekly for months now. And Dr. Milton has spoken a lot about this as well as our resident infectious disease expert. However, there are those individuals that get infected and have a very fulminant course of disease. And that's not always predicted by your underlying comorbidities. There's no question that if you have underlying comorbidities like cardiovascular disease, chronic lung disease, diabetes, morbid obesity, we are seeing that those patients have a greater risk of having a more severe infection. But that does not mean if you do not have one of those diagnoses that you will not have a severe infection. And I think that as with anything else, because this is also a newer entity for us, we don't have a long track record prior to this year. There's still going to be a lot more that we're going to find out about this virus.
Okay.
I think it's also important to note on that those social media posts, the tone of those social media posts is focused on how do my actions affect me? And I think we all need to understand that we have a larger responsibility than just how do I best protect myself? Because with regard to face coverings, it's not about protecting yourself, with the exception of the K95s or N95s. It's about protecting the people that you're around and that you're interacting with. So we have a larger responsibility than just to look out for ourselves. In fact, I would say looking out for ourselves is a smaller responsibility. Looking out for our neighbors and our loved ones is a larger responsibility. And for that social media post, I think if we can just take that approach, that mindset that we're looking out for each other and not just looking out for ourselves, we'll do better as a community.
Absolutely. And with the COVID outbreak, certain colleges have been a major problem across the country. Michigan State, University of North Carolina. Is that something you're worried about? Are schools in the area, something happening there, or?
You know, we have really great relationships with both Amarillo College and WT, and they've worked very hard to implement good plans. And so we, just like Mr. Miller said, we have to think about each other. And I think that the plans that they have put into place really are focused on protecting their students and protecting their staff and protecting their community. And so we appreciate their efforts. And we have certainly worked with them to make sure that they have that we have good open communication and that they have open communication with their students. And so we know that, anytime that you're in large groups, that certainly increases the risk. But they certainly have good plans in place, and so we appreciate their efforts.
Okay, and final question. I know you were talking about the the increase in cases. Is there any red flags that you can think of that might have caused that, or?
So we don't currently have any really large hotspots. I think the main effects that we're seeing right now are from Labor Day and the opening of school and different gatherings. And so again, we just ask our community once again to really think about their actions, wearing masks and social distancing. This is really hard, especially with the holidays coming up. And so but each time that we make that choice, it makes a big difference for all of us together in the community.
Okay, awesome. I appreciate everyone's time. Thank you so much.
Thank you, Matt. At this time, this concludes our Wednesday news conference for the latest in COVID-19 information. Once again, we do these every Wednesday at 11 a.m. I want to thank all our panel members who took the time out today to participate and provide this information to the community. This is David Henry. I'm the Communications Manager for the City of Amarillo, and we'll see everyone next week. Thank you.
Thank you.